Hello, and welcome to our OIG Workplan Enhancements and HCP Program Updates webinar. We are glad that you are all able to join us today. My name is Misty Sudbury, and I will be moderating the webinar today. Before we get started, let me address a couple of housekeeping items. This webinar will be recorded and will be published next week in the HCP Compliance Insider newsletter with a link to view at your convenience. You can access this and any other webinars that HCP has hosted by visiting the News and Events section of the HCP website. Also, if you have questions during the webinar, please post them using the GoToWebinar dashboard. We will answer questions as we go when possible, and we will hold a brief Q&A session at the end of the presentation. We will try to address all questions that come through, and we'll follow up with an email on anything that we are not able to cover. And finally, at the end of the webinar, you will receive a short survey. Please let us know your thoughts about this webinar or anything that you'd like to see in the future. HCP is driven by our clients' success, and we love to hear your feedback. All right, here at HCP, our focus is to provide our clients with timely regulatory updates and to offer the necessary tools and support to ensure that you meet those requirements. I would like to take a moment to introduce our presenters. First, let me welcome Brian Roberts. Brian is the Director of Operations at Healthcare Compliance Pros. We also have Chad Schiffman with us today. Chad is the Director of Compliance here at HCP. Brian and Chad will be addressing recent changes to the OIG work plan and introducing new tools that HCP has developed to ensure our clients maintain their compliance easily, stress not included. And with that, I will go ahead and turn the time over to our presenters.
Thank you so much, Misty. Like Misty said, my name is Brian Roberts, and we're really excited to be hosting this webinar. There's been a lot of work and effort that's been put in, really going back, honestly, really since the election. So much has changed, and we're seeing so much movement now, especially just through the federal government there in DC. We've been hearing a lot of questions, concerns, wanting more help from our clients as we go out and interact with different healthcare organizations, business associates. This has become a very hot topic. And in the past, many of our clients that are on this call today and have been with us for several years, I'm sure they've appreciated the guidance that we've provided, the policies and procedures, the training that we've been able to implement for their staff. But it's really getting to the point that that's not enough. There really is a lot more that is needing to be continually updated, some hand-holding that still needs to happen, and it's just starting to become something that you really need to have that expert there to make sure and ensure that you're meeting these requirements that's expected of you, not only now from the government, but even the private payers are looking for these things. So we're very excited for this call today to talk about how we have made these enhancements to make managing specifically your OIG work plan more efficient and easier, and show you how we're going to make this, take away this burden for you. At this point, as you can see on here, OIG, what's in it for me, right? Big burden, lot of questions out there. We get them daily on how to manage this effectively. So with that, I really want to just ask Chad, our Director of Compliance, who deals with this daily. Chad, what is happening up on Capitol Hill?
Well, so we're seeing a lot of movement right now, primarily due to, in the past it used to be that we'd get that annual update on the OIG's work plan, and now, they've changed it. They're just providing monthly updates. So we have to keep a close eye on that and to find out, what's going on with that. Essentially what we're seeing is, the OIG's voluntary compliance program that so many of us are used to hearing that term. We're finding that it's not voluntary anymore. We're finding practices are being held more accountable for having this compliance program in place in these elements that we're going to talk about today.
Yeah, and you and I were talking earlier this week. You even had a specific example of an organization, a small organization that had a very interesting audit and inspection that happened to them. Can you kind of provide a little detail and, for a foundation to show why we've made these changes?
Well, long story short, OIG walked into a practice and said, we're here to perform our inspection, and apparently the practice administrative staff or whatever, we're not brought up to date on what should be happening, denied the OIG inspector, said you'll have to come back, you can't be here right now. Nobody ever got back in touch with the OIG inspector. So long story short, this practice ended up being held accountable for that and was fined for not making sure that they followed through. So it's very important to be ready in the event of an OIG inspection, and that's one of the things that we're hoping to be able to help all our clients do.
Yeah, and a lot of this comes back to many of you on this call probably have attended seminars, webinars, are utilizing online services like HCP. You have your policies in place, you're training your staff, but are you following through on what those policies are telling you that you're supposed to be doing? And that's something we're excited about to show you how we've really kind of made that more easy for you to accomplish, and how we really are going to become a partner with you to make sure that you are meeting those, so that if an audit does happen to you, or if you get a letter in the mail, or if your private payer is asking you for documentation on monthly monitoring, for example, that you're prepared. You're not sort of left in the dark saying, well, I took the training, that's enough, right? And it just isn't, it's just not enough anymore. So as you can see here on this, oh, go ahead, Chad.
So yeah, that's one of the things we're hearing too, is a lot of the private payers, a lot of clients have reached out to us and said, well, why do I have to attest to doing this? And that's what, we're trying to help with, is making sure that you have all those ducks in a row, that you're ready in case you do have to attest, And we'll talk about those elements as we work through this.
So we're definitely going to be talking a lot about this primarily on the call. As Misty said earlier, as you're hearing us talk about these things, we encourage questions. We're going to try to answer as many questions as we can as we go through this. We're trying to keep this to an hour. We know your time's important to you. It will be recorded, but if you do have follow-up questions or would like some more one-on-one help, definitely, if you're seeing anything in here that you're interested in wanting some assistance from Healthcare Compliance Pros, we would love to have that conversation with you. So with that, we're also going to cover some other topics. This is kind of a all-encompassing some new features of what we're covering even outside of OIG. So Misty, can you move over to the next slide there? Yeah, so we've got a couple new products that we're excited to announce that many of our clients have been anticipating. First is our Credential Manager, which is going to now allow an effective tracking mechanism for you to provide reminders, receive reports, and document and archive all of these credentials, licenses, certificates, certifications of your staff and providers and other employees. So we'll be covering that as well today, along with background checks. So for your prospective employees and applicants, this does also come back to the OIG, one of the elements in making sure that you're performing those proper background checks before hiring. So we are going to just jump right into the website now, and I'm going to sort of take over control here. There we go. So at this point now, everyone should be able to see my screen. And we're just logged into a demo account to show you some of these services and features that we've been talking about. Now, as we talked about, again, trying to ease the burden of managing your OIG work plan, the way we've done that online and through your corporate compliance program is by really, in the past, some of you this may not look familiar. This screen may not look familiar to you, but many of our clients, our administrators, they're familiar with the training dashboard. Down here under compliance management, this is where they manage their HIPAA breaches, their business associates. Well, we also have some new additional compliance management questions for you to effectively meet these OIG requirements. The first one we're going to talk about is the compliance committee meeting. So we've developed an agenda we have a question in here to make sure that you're meeting this requirement. And we basically show you and kind of lead you by the hand what you're supposed to be doing with this corporate compliance meeting. Who should attend it? How often should it occur? You will receive a reminder. These reminders do come quarterly. Now you may say, do we have to hold these quarterly? Chad, would you like to answer that question?
Yeah, it is definitely recommended to hold them quarterly. Just due to the nature of things that come up and need to be talked about, it's good to keep the compliance committee, informed. And oftentimes, it could be driven by a compliance officer, audit findings, different things that you want to discuss. This is a perfect opportunity to do such.
Yeah, and it's the recommendation. It is not the requirement. Now, we always want to basically give the best practice standard here. So we do work with you to try to help you meet that quarterly requirement, or excuse me, recommendation. That being said, if you can't meet it, if you're a smaller practice, smaller organization, the important thing is when issues arise, when there are concerns, that they are being discussed in those compliance committee meetings. And we've got a couple samples here to just show you as you document these and use the agenda that we have. It's very much like a minutes for a board of directors type meeting, but we call it to order. You've got who's in attendance, when it's held, and then we have the agenda items for you. So again, we're telling you and showing you what you should be talking about, what you should be documenting, and making sure these specific things are being discussed, especially items that may have occurred within the last 3 months if you're holding it quarterly. Along with this service, again, you have your compliance specialist. When you get this reminder, if you're holding it for the very first time, you can reach out to us. We'll walk you through, we'll even attend those initial compliance committee meetings so that you understand what you should be doing, how you should be holding them. But just like we go back to that example of that practice that had that investigation, if they had this documented, if they said, yes, come in, here's our documentation, here's our last meetings, minutes of our meetings, here's our last assessments, it would have been probably an open shut case for them as far as just meeting the requirements the OIG was looking for. So the corporate compliance meeting agenda is one of the new items that we're trying to show and help you, not just tell you should be doing this, but actually send you out the reminder and provide the tool for you to perform it. If you do reach a situation where for some reason you got busy or you're not holding it, we will proactively reach out to you and help assist you to say, how can we make sure this is happening? Even if you can only hold it once a year, we're going to be there to really help you meet this requirement because we want you to meet that element of the OIG's work plan.
Brian, can I interrupt you with a question really quickly?
Sure.
So we had a question come in asking if an inspector walks in to perform an audit, are they satisfied with an organization just opening up the HCP database and showing these links to the meetings that have been held and other monthly reports, or do they need to download them and print hard copies?
Go ahead, Chad. Yep. Well, I was
Okay.
just one comment I was just going to first make is first off, they're never just going to walk right into the door. You will get some kind of letter, you'll get some kind of pre-notification. And the first thing I would want them to do if they were using our service is to reach out to their compliance specialist. That's something we include. We will help prepare all that documentation. We will help them be prepared for that meeting. But Chad, I think you were going to add something to that.
Yeah, we do help them with that, and that's one of the ways we do it. And we have had clients too that have just simply turned over the HCP program to inspectors, and they've been totally satisfied. So, it often depends on the inspector, but either way, we're here to help you. We'll make sure you're covered. So, and on that, I'm getting it.
Yeah, Chad will get a drink of water. But yes, everything that's archived and reported, you can print off if you have an inspector that's looking for hard copy. But that's a great question. So along with the corporate compliance, or excuse me, the compliance committee meeting agenda, we also have made some enhancements to our exclusion monitoring. So we have had in the past for several years OIG, the list of excluded individuals and entities, the OIG's exclusion list. We've monitored that for clients on a monthly basis and send those out in an email format. So you can see here in this demo account, every single month it's documenting and showing that history. When you click on a specific report date, you can see when it was pulled. You can see the list of entities, if there are any exclusion matches found, individuals as well, along with your employees. So that will continue. The addition, however, now is we have also now added the SAM exclusion list. So the system of award management is now an additional list that will be monitored monthly. So you can see down here, if there is ever an exclusion match, you will see the name of your employee or the entity that we're monitoring. It will mark X if there is an exclusion or a SAM exclusion or an OIG exclusion. So that's something I know many clients have been requesting, and they're starting to see private payers and other organizations that they interact with that are wanting that monitored for them. So we're excited to announce that we do have that included.
These reports have been very helpful. In fact, we have a client that I can speak to that has to provide these reports on a monthly basis to their payer as part of their attestation, and these reports help them support that attestation. So pretty excited about the SAM monitoring being added.
Yeah, and with the SAM monitoring, it's a smaller list. I will tell you, the data points that we monitor, if there are hits, sometimes there are false positives. So we do obviously have instructions here. You could see, for example, if this Elizabeth Betty was not the true Elizabeth Betty that was on the exclusion list, you could hit ignore, and that would stop basically having her pop up as a hit every single month. And then probably every 6 to 12 months, you would want to release her. The instructions are right in here to show you how to do that, but your compliance specialist will help you with that. If you have some false positives, the SAM exclusion list does provide more false positives than the OIG list, just because of the data points that they're allowing us to hit from their government website. But like Chad said, we've got both of these being monitored for you on a monthly basis. Along with the exclusion list, one of the big enhancements, and this is probably the most important one, is the new corporate compliance assessment. So for those that have participated in our HIPAA compliance program and are used to performing their HIPAA walkthroughs and their security risk analysis and performing those, at least on an annual basis, we now have a comprehensive corporate compliance assessment that will be scheduled for one or more people in your organization, depending on their role, to perform this and submit it to us for review. This is not something that you just fill out and say, I filled it out. We're asking you specific questions to submit to us so we can ensure you're meeting those elements that the OIG is wanting you to. Again, I'm going to emphasize this multiple times on this call. The difference between how HCP chooses to manage your compliance program and some of our competitors out there is we do have experts looking at this. It's literally impossible for you to just build a formula and say, as long as you click here and type this answer and this response, you're compliant. Because everybody's situation, whether you're a business associate, a healthcare organization, maybe you're a little bit of both, you're a covered entity and a business associate sometimes, you're going to meet different standards different ways, and you just need an expert to be looking at that. So for that reason, we ask you certain questions to get certain response and hope to receive certain responses from you. But if you don't have them, that's okay, because we're going to work with you when you submit them to us. So as you can see in this assessment, we do break it out by element. This kind of works hand in hand with your policies and procedures that you've customized and that you're training your staff on. But now we're really kind of going more in depth in some of those areas. You can see here under element number 1, we're asking you, do you have a code of conduct? And if so, we want you to upload it. Now on this one, you can see it hasn't been uploaded yet, so it's yellow. So we're saying, okay, this is something we want to talk to you about. We want you to have this archived and uploaded, again, in the event of an audit. If you don't have one, hey, we've got a sample one here for you. We've got something you can work with. or contact us. If you've got some things in place, we're more than happy to help you, but let's get this documented so it's all in one place so that you have, again, you're meeting those elements.
This really is helpful if you if you are audited as part of your attestation process to say, hey, yeah, we are meeting this, and they come in and say, well, prove it. We have it all documented here in one place, so it makes it quite convenient.
And another thing is this will change over time. Your organization might grow. Sometimes you'll be working with your general counsel or your internal compliance committee and make changes to those. So when you do submit these, there is an archived history of this assessment, and it's time-stamped, and you can look at that specific report so you can see when it was marked complete, so you can see the submission from you, and then ultimately the review by healthcare compliance pros. And you've got a documented archived version of this assessment as of July 25th, 2018. Well, maybe in 2020, that's going to be different, and there's going to be some changes there. So having that archived history to actually show that you're continuing to improve, that's what compliance is about. Compliance is not, hey, I'm 100% compliant. No, it's, hey, I'm actually more compliant today than I was yesterday.
Brian, we have a couple of questions that have come in that are probably good to interject right here.
Sure.
The first one is, I work at a practice that has numerous locations. Are these required for each location?
So this specific assessment, if you're talking about multiple locations that really are utilizing maybe the same policies as the parent organization or the primary organization, just because you have multiple offices does not mean that you need to perform this assessment for each location. If you do have, if they're separated enough, if they're a different TIN, if they do have different unique policies, then yes, we probably would want to say, let's perform one for each. But that's a conversation that we would have with you, and we would find out more information. Some people have multiple locations. They have the same policies and procedures and training, but they have different EMRs at those different organizations. They have different ownership still under those organizations. So we'll have that conversation with you, and we probably want to just address that question on a case-by-case basis, because it could go both ways. It could be you could just perform it once for both locations, or you might need it. You might need a separate one for each. Chad, did you want to add anything to that too, or is that pretty much?
That's pretty much it in a nutshell.
Yeah. And was there another question on that, Misty?
Yes, a couple more actually. What if I fail an audit? Is HCP going to help me?
So as you'll notice here, as I've scrolled down here into these different elements, as we're talking about this, we do have a big section on the monitoring and auditing. And definitely, if you're utilizing our service and we're providing you any instruction or information on what you need to do to become compliant if you are out of compliance, what we're really excited to announce is if you're participating specifically in our corporate compliance auditing program, so if you're actually having us maybe help you audit some of your encounters and surgical procedures, indemnification is included in that. So if we're to the point that these parts where it's saying, please provide audit support, supporting documentation with regard to your most recent billing and coding audit findings and when you held those. If you're choosing to utilize some new services that HCP now offers, and we're actually performing those audits for you and providing the recommendations, yes, if you fail that audit, you're indemnified by HCP, and we're going to help you. If you're not utilizing this service, we're definitely still going to help you if you are audited. We'll provide, we're still going to hold your hand. We're still going to, want you to make that phone call to us saying, the OIG is coming in, what should I do? We're going to tell you what information to print out, what documentation to provide, and hopefully you're following the program. You're performing the assessments, you're holding your compliance committee meetings, you've got all of your employees uploaded and your business associates uploaded, so they're being monitored properly. But beyond that, if you fail an audit and you're using this service, you're going to be covered. With that, I want Chad to talk a little bit about this section. This is a very critical section that many clients have been very concerned about in the past. They've read our policies, they've talked and heard about internal reporting mechanisms and systems of what they should be doing. We're getting clients saying we've never developed an internal auditing system. We don't even know where to start or begin with that. Chad, do you have just some insight with what you've been helping some clients recently in this regard?
Yeah, so we've been talking about internal auditing programs with clients. Specifically on building and coding have been a lot of the big ones that we've had lately, and what they're doing as far as those. And as you've mentioned, we found that a lot of clients haven't had that. So we've actually got a full-time auditing department here that can help with that. And what they'll do is it's a third party. We use them, and we have our team, and they'll go ahead and audit and make recommendations. And basically what's happened with that is that a lot of the frustration we've heard is, we just can't get our providers and our billers and coders to agree. So we sort of take out that middleman, and we become that person to go to them. And well, we are the middleman, I guess, and we help get everybody on the same page, make sure processes are in place, make sure auditing's in place, and just kind of help that process. That's kind of the biggest thing that we're seeing happen right now with it. And it's not that you have to have an external auditing program, but it is highly recommended. Definitely want something internally to make sure you're getting the right codes and those type of things going out. But yeah, to have a third party look at it, we highly recommend it, and we'd be happy to help with that process. So.
And in many cases, you'll actually find that this could not only save you from possibly some fines or penalties, or ultimately maybe even being shut down or having your doors closed, but could be, there could be money being thrown away. There could be lost, opportunity there with, situations like undercoding. So sometimes it is, we know it's something, it's a budgetary issue that sometimes has to be discussed, but if there is interest out there, and we've had some demand, we do have that program. We're not going to go into depth in it today, but that corporate compliance auditing program, the benefits, what's included with that service, if there is interest, that's something that will be provided in your survey, that you can reach out to us and we can talk to you specifically with regard to your organization. But this assessment, again, it comes back to helping you make sure that you're meeting those OIG elements, not that you're just training on them, but that you're actually following through with what is provided in those specific elements. And one of the final elements we'll just talk about in here is reporting mechanisms. Since this is another tool that we have added to help you meet these OIG requirements, it's very important to have open communication in your organization. I'm sure everybody understands that. Sometimes, however, there are those situations or scenarios where an employee, maybe even an executive level employee, doesn't know who they can talk to. Sometimes it's a small organization, and it's very hard to say, it might be your superior that you're needing to talk to somebody about, and you don't really want to let them know that it's coming from you. Well, the OIG does highly recommend having some kind of hotline, some kind of anonymous mode of communication for those types of instances. This is not something to put in place to reach out to the OIG. This is supposed to be internal. This is a mechanism. In the old days, you could, if you remember, the suggestion box that sits there and it's locked, right? So it's that kind of a concept. In fact, we even have recommended that to some clients that are just in a small office, to say, have the suggestion box still there. But we have made a new enhancement and tool, and it's called our compliance hotline. The compliance hotline is completely anonymous. So if you see here, we're down at the office level. At the office level where your employees do take their training, you can see there is a new tab here for the compliance hotline. They can access this online, and it does provide instructions and a little field here for them to submit a question or concern. There is an option if they would like to receive feedback for this submission, which I'll explain in a moment, and then they can submit it. The important thing I want you to know about this is, you can see I'm logged in as a user. There's an email address tied to this. There's a first and a last name tied to this. None of that information with this technology is actually provided to the administrator. Also, this information is not even provided to us. We actually coded this so that it would not be information that we couldn't look up on the back end. So when people do submit via online, and that does send a reminder to the administrator that there's been a compliance hotline question that they need to look at, they will not, the only information they will see is the information contained in this text box. So if the employee go ahead, Chad.
I was gonna say, one of the great things to me about that is, this compliance hotline tool allows that anonymous report, and by that, it doesn't ever result in a regulatory action against the person making the report, but it does help you be aware of what's going on in your organization, which is a powerful tool in my mind. So.
Yes, this is an internal whistleblower. This is not a external whistleblower. This is not the employee reaching out to the government. So it's really what the government wants in place. It's like, you guys can handle this, and provide a way that your employees will feel comfortable doing so. Now you'll notice on here, we have created an enhancement because sometimes this tool could be used more than just for the OIG. You can use this for HIPAA related issues, HR related issues, OSHA related issues. It could just be maybe organizational issues. Hey, there's a policy, an internal policy with our company about, we don't allow people to take time off to vote. And I think it would be great if, you gave us a half day to encourage people to go out and vote. This can really truly be a suggestion box type of program as well. But it's really meant to serve primarily for meeting that OIG's requirement. That being said, if they would like feedback, the feedback is still anonymous. They can at that point provide an email or phone number. I just want to bring this up. If they do choose to use email, we still do not see it. It's completely automated. So just so everyone understands how this would work, if I typed in my email address, here's my personal email, so everyone now knows my email and phone number now. Please don't call me. But if I did this and I submitted it, when the employer receives the request and they investigate it, when they complete their investigation, it will actually email me to whatever address is in here, and I can see the response. And that's all it does. It's just like, hey, here's how we're responding. Now it does allow a comment feature, just kind of like how social media allows you to maybe make a post and you can comment on a post. So you can kind of keep commenting back and forth if you want to keep a dialogue. Say, for example, it's an employee who says, I feel like I'm being harassed, and it's an individual, and I don't even want to mention them, but here's how it's affecting me, and I just, they maybe they don't give you enough information, and so you start a conversation back and say, here's how I'm investigating this based on how much information you've given me. If they request feedback, you guys can keep commenting back and forth, and a conversation can happen there that's being documented and stored in your system. So this is how you can submit it. Now it can also be submitted. We do have a form that you can print out and you can post it in your break room. You can post it wherever your employee information is. You can email it out so people are aware that here's a toll-free number or an email address, and they can also email or call in. Now, some of the anonymity dies a little bit there when they email, because based on the email, we will see that. But through our online system, we will not see it. All of our customer support agents have been trained that when that email comes through or when that phone number is dialed, how to treat those, that we're not asking for names, we're not asking for any personal information, we're just taking the question or concern, we're asking them who their employer is, and then we're basically in effect submitting this on behalf of them if they choose to do it that way. So I want to actually show you now what this looks like from the administrator side, so you can see how this is documented. So if we come down into, again, the compliance dashboard, you can see you would be getting a notification. Are there any suggestions in our compliance hotline? Right now it says no, and that's because there aren't any open suggestions. If there are open suggestions, this would say yes. If you click on it, however, we do have a sample closed suggestion that's been completed. And so I'm just going to show you this. So on this specific one, you can see here is the submission. I have a complaint. I'm concerned about the frequency of overcoding our practice is doing when I've brought it to our billing department, blah, blah, blah. Then we have the investigation. So this response, the person that is over this over receiving these, you can add the person's email address, so the administrator would get a notification. They would be able to log in, submit their response, and then go ahead and say this specific submission is now open or closed. If they choose to close it, it's archived. You cannot go in and edit it after it's closed. But as I said before, you can continue to comment on this. So if you want to make additional comments, maybe there's follow-up investigation, maybe there's new information you learn after the fact. The important thing that we're doing here to meet the OIG's requirements is this is now showing that documentation of you guys are taking these submissions seriously, and you are continuing as need be to meet those investigative requirements. Chad, is there anything you wanted to add on that?
I think that pretty much covers it in a nutshell. I think we're good there.
Perfect. So that is some of the new enhancements we've made to our OIG's work plan. We really feel strongly that these are going to help you meet those requirements better, that the OIG 7 elements. We are going to have time, hopefully, hereafter. We're going to switch gears and talk about some of these other new enhancements. But if you do have more questions, again, please submit those, and we'll hopefully get to cover some of those at the end of the call. And the ones that we can't, we'll address separately. So, OIG, what's in it for me? We're going to push that over to the side for a minute. Now we're going to talk about some of these additional new tools, enhancements that some of our clients have been anxiously waiting for. The first one we want to talk about is our background check service. The background check service we have integrated with a third-party company called VicTig, V-I-C-T-I-G. They are a third-party vendor that performs these background checks. We've integrated their software into our system so that you can effectively manage it in one location. It's very user-friendly and straightforward. You can see here we can create a new applicant. It has the instructions. The only information you need to provide is just their name, a personal email, and their physical address information. Now this is important, it's required, because what happens is when you do choose the specific searches you'd like to perform on them, and remember this is pre-employment, so they're not a user in our system, you can go ahead and select those specific reports, and you can see there is a cost, but it's a very heavily discounted cost. For those that do background checks on employees or maybe are using a third-party company, hopefully you'll be very pleased to see how much, even if you chose to use all of the specific checks, it's very affordable. And then you can go ahead and submit that request. I'll talk about some of these checks here in just a minute. But what will happen is upon submission, this information is sent to the third-party vendor, who then sends the email to the applicant, and the applicant does have to verify based on the specific search and provide information basically approving this check to be performed. Now, some of these specific checks, the national criminal search, it's going to basically check every federal, state, and local criminal database. If there is a hit, there is some instruction in here. If there is, for example, maybe they had a hit on the federal database, there will be an additional cost to pull the federal criminal report of $6. We're only going to pull that if we actually see that there is a record out there. So if there's a statewide, if say for example they have a hit on a specific county, they're going to search all of those county records and pull those reports. There's an additional $10 cost, but you're only hitting those if they actually do have a record out there, and that's why we keep it low initially. Verifications, I apologize, we are going to put a better explanation here. I will tell you the verifications, it's an $8 cost. This is checking personal references. This is checking background on their education, whatever they're putting on their resume that they're saying that they do or that they've done, any certifications, any references, as I said before, they're going to verify that, and they verify it through the information they send to the applicant via email. So if you choose verifications, it's going to force the applicant to say, who are your references? And then they verify them for you. Where did you graduate from school? And then they look up that school and confirm that they have done it. So it's a very powerful background check. And then lastly, I do just want to mention the FACES search. So this checks all state Medicaid sanctions, 42 heat sources, 51 Attorney General notice and release sources, all state level debarment sources, and any sanctioning boards from all 56 U.S. jurisdictions. So there's more than 3,000 sources of information being accessed when you're looking to maybe hire a new doctor, any provider level or above individual. This is a search you definitely want to do, this FACES Level 3 search. Once you do submit it, I'm going to back out here and show you one of our existing applicants. So you will receive a notification. You can see you've got your active applicants and your archived applicants. You know, right here, there's no requests. Okay, so right now, John Smith, he hasn't actually said, okay, I'm allowing this. The next approval status is pending. So once John actually says I'm allowing this to be performed on me, then it will be pending. That's when they're actually performing the background check. When the background check does come through, you will see a complete status and you will receive an email notification. You can see you can manage who receives those up here. So you can just add the specific employees that you'd like to be, or excuse me, add the specific administrators of this that you'd like to receive that notification. But come back here to this screen. Once they do have received, their background check has come back, you'll receive that notification. You can log in, click on that applicant, go to the background check. You can perform more checks if you like, but you can just go to the history, click on that specific report, which then pulls up, in a PDF report, and now you've got that, you've got that specific, whichever one it was. This was the criminal check. So you'll get that. You can review it based on, how at that point, if you're going to make the offer, if it clears, you can then at that point immediately create them as a user in our system. It will take all of their existing information and you can add their new company email, their new password, and basically create them as a user, and it will still archive any reports that they had in their system. So pretty straightforward. It's not too complicated. Again, we're very excited that we have this here. When you choose, if you choose to use this service, obviously we're going to give you all the instruction and support to help you make sure that you're managing it properly if you do have additional questions. And then finally, we have our credential
Brian,
manager.
sorry
Yes,
to interrupt.
sure.
So we have a lot of questions coming in
Okay.
relating to the background checks. Would you like to go over some of them now, or do you want to wait till the end?
Yeah, we can let's take a couple of them real quick before we move on.
All right, perfect. So the first one that came in, sorry, there's so many here. If a group has multiple administrators, will they be able to limit? Oh, sorry, this is actually for the compliance hotline. We'll get to that one in the Q&A. For background checks, are the background checks required for new hires?
So, Chad, would you like to address that at least from the standpoint of the OIG on probably specific types of employees, really?
Yeah, so OIG, anybody who's involved with the claim period should be screened against the OIG exclusion list. And now SAM for a lot of organizations is what we're having. So that's why we provided that as part of our OIG screening service. Brian, is it covered in the background check tool as well? Do they screen against the OIG and SAM, or is that just completely separate?
So they do have SAM. They do have the SAM in there because we have the OIG separately. We can allow them to do that, but there is a way for them to get OIG and SAM exclusion monitoring.
I saw that question on there, so I thought I'd just go ahead and continue while I was talking, but and answer that while we were at it. But yeah, no, that's why we request that. And then background checks from a standpoint, whether it's we talk about it like in our security risk analysis, for example, and one of the things we'll ask is what's in place, and it's addressable. So there's different ways you can go about it, whether you're checking references, whether you're doing criminal history. It's often set on your practice policies, and even some state considerations as well. So is it required? Not all elements of them are required, but some organizations have those policies and procedures in place to cover them all. So
yeah, and so I guess as Chad just said, best practice, right? If you're hiring, let's say for example, 5 to 10, you're a large organization, maybe you're hiring 5 to 10 individuals a month. That could become very cost prohibitive. To say, yeah, I'm hiring a front desk staff employee. First off, you do see that you have different levels. Let me back up here to the account level, different cost levels. So you can do that exclusion list monitoring for very affordably. It's $2. Okay, so if we click on, the specific employee and look at the check here, $2 to get that SAM search. And honestly, it's not in here, but the OIG search is just going to be included because we have that built in already to our system. So we can perform that OIG check for you. Do you need to pull a criminal check on that front desk staff? That's got to be an internal policy. You got to decide what access that person, what other job responsibilities is that individual going to be performing.
That's interesting. You bring that up. We've had some conversation about that due to, whether it's firearms policies in organizations, whether it's new, the opioid focus. People have been asking more about background checks. So that's why they're doing them now. So.
And I think the catch-all response I would just say is it depends. So if you want, we can have a one-on-one conversation to get more information about your situation, what your policies are to address that. But definitely, if you're hiring somebody of that provider type level, you're going to want to perform things like the FACES, and obviously I would even say the criminal as well. Some of these others, you're just going to have to make those judgment calls on how much you want to do and perform. Was there other questions, Misty?
So yeah, that brings to another one. And I just want to remind everybody, if we don't answer your question live during the webinar, we will follow up afterwards and make sure that it gets answered. But the next question was, does the FACES search include SAM and OIG?
So it is actually separate from SAM and OIG. These are actually looking at different sources. So that's the answer to that question.
Okay.
Yep.
And
maybe just one more and then we'll move on to credential.
Let's see. Is the background check a separate fee or is it included in our normal pricing? So how will the pricing work on that?
So that's a great question. So obviously one thing we haven't addressed yet is these new enhanced services for especially our existing clients. Do I have these services? Are these, is there an additional cost for these? We will have to look at that based on what service you currently have. For clients that have our enhanced human resources package, some of you do, this will be turned on for you. However, as you can see, there are just additional costs regardless for actually submitting a specific background check per applicant. For those that don't have the service, there's actually a bundled package. It's our background check, our credential manager, which we're going to be talking about here next, and then also our employee virtual binder, which many people have been using before, where they can track their documents, notes, and reminders for individuals or for their staff. So that package, if you have it, it's going to be included. If you don't have it, then we will talk to you about adding that and just telling you what that additional cost would be. This is a unique service because we're integrating with a third-party vendor. We've negotiated these prices. These prices are discounted below, so they're wholesale prices than what you could get directly from them. And we've also looked at the marketplace to see, we really aren't here to make money off of this. This is just more of a service for our clients to say, you can now perform these background checks here because in essence, we really just want you to, as much as possible, have this meet the OIG requirement. Do you have to perform all of these checks to meet the requirement? No, you don't. That's not what they're saying. Do you need to probably look at some SAM exclusion lists, some OIG exclusion lists before you hire somebody? Definitely, you need to. You don't want to hire anybody that are on those lists. So let's move on to Credential Manager, and then if we do have some time, we can take some more questions on that background check. As Misty said, the questions we don't get to, we are going to be addressing those individually offline. Credential Manager is another great tool that we're very excited about. The nice thing about this system, first thing I want everyone to understand, we are not credentialing any of your staff or providers. Okay, this is just a tracking / managing system for for how you're currently managing it. You might be using another piece of software, you might be using an Excel spreadsheet, you might be doing it on paper. Regardless of how you're doing it, when you look at this, you'll probably really see a lot of great value out of this. But the way it works is, as you can see in here, you can create as many credentials as you like. We've got some preset credentials in here already, and there's no limit to this. So when you add this or subscribe to this service, you could have 100 different credentials in here. We're not going to charge you more by credential. You just have the service turned on. But you can see here it gives you a little instruction as the administrator. It has a little legend to show you if you're in compliance or if maybe there's some issues here. We do have some issues that I'm going to address on some of these. So let's look at this insurance carrier one. Now, when we edit it, this is just like creating a new one. You come to this screen, you can always update the title of the specific credential. You can provide contact information. This is just, who's your contact for that specific insurance carrier, so everyone knows, whoever's managing this, who they need to reach out to if there's issues with that specific credential or that organization that you're receiving the credential from. And then down here, you can actually manage the email message that goes out to the individuals to perform or update this credential. So in essence, the service that we've provided is it allows you to create a specific credential. This could be a license, a certificate. Maybe you have individuals in your organization that are CPR certified and you want to make sure that stays up to date. It allows you to create the credential. Then it allows you to assign the individuals that need to maintain that credential. And it allows you to create a message, because what we're doing is we want to make sure that a reminder goes out to that individual sometime before the credential expires to make sure that they recertify or get the new credential, upload it, and then put in the new expiration date. And so that email message, that custom message based on the specific credential, is something you get to control. You can say who you want them to reach out to. You can tell them, you can give them the contact information. You can give them whatever you'd like to say, this is the instruction of what I need you to do. You can also provide attachments. So if there's a specific document, maybe they always have to fill out this application. We always have to submit this to this organization when we're getting recertified. You can provide that, and it's stored there indefinitely. It's always there. You can obviously replace it if there's an updated version. And then you do have some ability to actually control what kind of access the specific user will have when they do upload. So you can see allow user to replace documents. So let's say they accidentally uploaded the wrong document. We are giving you control to say whether or not you want them to replace it. Probably okay to allow them to replace it. Maybe it was a mistake, but we've actually had some clients who say no. We actually, when they upload something, we don't want them to replace it because we want that to be kind of basically locked. Allow them to delete it. Honestly, we don't even know why we have this here, but it's an option. You can choose to allow them to delete a document, but it's probably most of the time going to be set to no. So you'd never allow them to leave it empty or delete an existing document they uploaded. And then the reminder period is the critical part. So let's say, for example, let's go back. We're talking here with an insurance carrier credential to maintain that with that specific insurance carrier. Let's say that it's something you have to re-credential annually. Well, you don't want to not have a reminder in here and get reminded on the day that it expires. So you can say, I want to be reminded one day before. It depends on if that's how you want to do it. 1 week, 2 weeks, 2 months, 3 months. We've kind of limited it to that because we really feel if you're getting a reminder 6 months before, what's the point? You don't need to worry about it yet. But you can set it, maybe 1 month before. Go ahead and save that information. It's updated it. And now what will happen is if the expiration date for an individual, if we come to the users, so we've got right now 3 individuals that are assigned to this insurance carrier. If you can see when their expiration hits, all of them are set to the 15th right now. So all of these 3 users will get a notification on July 15th. And I know this is set to the 2018. So they theoretically got a reminder on July 15th saying, you need to update this. You need to provide the new expiration date and provide us the new credential for this specific certificate. Over here with reminders, you can say how often you want to continue to remind them. So let's say Abraham Lincoln, as we've got in here, he's getting it monthly. So if he doesn't, when he gets his first reminder on July 15th and he doesn't do it, he's going to get another reminder. And you can see here, it's just going to say, I'm going to hit on the 1st of every month. So he got his next one on August 1st, then he's got one on September 1st. Weekly would be the first Monday of every week that it hits. And that's just until they get it done. So it's that nudge that's saying, hey, you still haven't done this, you still haven't done this. And I would recommend weekly once it's triggered the event that you need to do this. One real important feature of this, you notice it's got all the employees in here. You can select who you want to assign, who's responsible, who has a credential that they need to make sure doesn't expire in here. So you can select those individuals, just update it, and it's going to add them. You'll see that there's this alternate email address, and this is something that is really valuable for people that are probably managing these. For doctors, doctors don't want to receive these reminders saying, hey, it's time for you to update your board certification. Hey, it's time for you to update your DEA licensure. They've hired administrators or somebody in their organization to manage this for them. And so if we have Dr. Stephen Martyr here, he doesn't want to receive this email. We can just say this is going to go to the administrator, and we can put that alternate email in. So the alternate email will get the notification 1 month before. The alternate email will continue to get it weekly on behalf of Dr. Stephen Martyr. So if you have assigned a specific person to manage the credentialing and licensure for your organization, you can put them in, or maybe multiple people. You can say, well, my supervisors over these 2 people is this person, and then my supervisor over these 3 people is this person. So you can put multiple people who are responsible for maintaining these and manage it that way. Now, once you've got it set up, that's a lot of legwork, and we do work with you to get those set up. Once it's in place, however, you can see when we come to the report, it's very easy to manage. You can set up an email list of the individuals that you'd like to receive this report. So if I want to be one of those individuals and I want to say, I want to receive this report, maybe I just want to receive it quarterly, just so I can kind of see what's going on. I can say when the first send date is and put that in. I can add that. Now I've got this. Maybe the credential of the person that's over this, I add that person, and I'm just going to put in a dummy email. Okay, maybe I want them, because it's their job, to be receiving this weekly or maybe bi-weekly. So you can set up different requirements of who's going to receive this report and how often they're going to receive it. They'll receive the report. When they do get it, they can click on the specific individuals. Why hasn't Bobby McFerrin, what's going on here? Well, there's nothing uploaded for him. So we can come into Bobby. We can go to that specific insurance carrier. And now we're in here as Bobby. So we're in his profile and say, okay, maybe you're managing this for him, right? Okay, we actually know that Bobby has finished this. Let's say that it now expires. We'll get into, August of next year. And so we're August 16th of 2019. Notice that it doesn't allow me to upload a file until I put in the new expiration date. That's to make sure that this is going to update and automate so that you don't have a bunch of uploaded files, but you still have expiration dates in the past sitting there. So once we put in the new expiration date, now we can choose that file and go ahead and pick that specific document, upload it. And then once this thing's uploaded, and I probably picked the wrong document, I just picked a PowerPoint document to upload, so it's taking a little bit longer. So once this is done uploading, we come back to the list, and it's probably because it's such a big document, it's not going to allow me to do it. So let's pick a different one. So the 16th, let's just get a PDF document here. So we'll upload this, and you can see now it's uploaded. He's green. If we come back to the list, Bobby McFerrin's has got his green check mark here, shows the date that he uploaded it. If you ever want to download the file, you can look at the file. This is in his profile, so if you're in Bobby McFerrin as a user, you can come to his documents, you can see his credentials, all the thing that's required for him. You can print out that report. And then if we do come back to the credential manager now, where you're managing this, if we come back into insurance carrier and look at our user report, Again, here's Bobby McFerrin. He's got that completed. So over time, as you can see, I didn't do this as Bobby McFerrin. I did it as the administrator. So if you're managing it for somebody else, you can do it. If you want the staff member to do it, they get an email notification. There's a hyperlink inside the email saying, click here to upload your new credential. They don't even need their username or password. It just immediately logs them in and takes them to that screen that looks just like this. So they immediately have the instructions saying, please upload your credential, put in your expiration date. And so once they do that, they can go ahead and just upload it and the work's getting done. Now it's being tracked, now it's being monitored. All of this is being archived by year. So you have a running, a running total, or excuse me, an archived track record of all these credentials year over year. There's a lot more that goes into it. That's just to the extent that we're going to cover, because I know we're short on time and I do want to get to some Q&A. Misty, let's see if we can go back. I'm just going to actually, if we can go back to the slide, I just want to wrap up and give some time for Q&A. But I want to get to that one slide. So as Misty is bringing us back to the webinar presentation, I do want everyone to know, I know we have some people who are just being exposed to HCP for the first time today. Healthcare compliance pros, we have an extensive industry knowledge in this area, and we utilize it to manage your compliance needs. We don't sell you a product and leave you to manage it yourself. That's one thing that we chose from the very beginning not to do. We continually listen to our clients and modify our programs to ensure that you're meeting the industry's demands, and our unique compliance solution is designed to reduce the compliance burden. So each client is assigned their own compliance specialist, and we make it easy and simple for you to manage that compliance burden, enabling you to perform your job effectively. Stress not included. That's our theme. We don't want that stress, right? So I appreciate the time. I'm so grateful for this opportunity. I know we've gone over. It sounds like we've got a lot of questions. Let's see if we can take a few of them at this time.
Okay. Let's see. So a question we got a little bit ago, how do you build the proper committee for compliance? Who should be part of that committee?
So one, I'll address the technical part, and then Chad can do the educational aspect. But when you sign up with us, we do send out some spreadsheets and some questionnaires, and we do tell you, who are some people that you should be on this committee, and it does depend on the size and complexity of your organization, but we do help you in that regard to build it. But Chad, you can give them the official answer.
Well, we'll typically see a compliance officer. I think that kind of goes without saying. You'll have your compliance officer on there, and for some organizations, the compliance officer is really all they have. But then, other groups will see compliance officer, provider, maybe an MA get in there, office manager, just different roles so that you get different
Billing
perspectives
manager.
on it. Right.
Billing manager.
Yeah, and we just want to emphasize that it's important to have a variety of perspectives on your compliance committee.
If your organization is as small as an office of 3, to the extent that maybe that lower level employee is somebody you would like to include in it, it could be all 3 of you. But as Chad said, we've had compliance committees of 1. So, other questions?
Yes. All right. With our compliance hotline, we had a few people ask, can we direct the submissions to go to just one or select individuals, or do they automatically go to all administrators?
So right now, the way the compliance hotline is set up, and that's not to say we would love feedback. Again, this is a new feature, but the email system is set up to just add as many individuals that you want to manage this, but it's not set up to say, remember that it's an anonymous compliance hotline. So when it triggers to the administrator who's got an email in there to be notified that a suggestion or a submission has been sent, we're not saying where this is coming from. So it kind of would defeat the purpose to a small degree if you said, well, we want administrator A of Office A to just receive submissions from Office A. Well, guess what? Now it's not anonymous to a degree because you know it's coming from Office A. Now, that doesn't mean that maybe if you're large enough, you're saying, well, we've got an administrator we're unique enough that maybe we need to have that discussion. And that is something we could talk about it from a development standpoint. But at this point, I just want to really, really overemphasize that concept of anonymity. When they come in, what I would recommend is having multiple people, depending on the size of your organization, that are responsible for this part of your compliance program involved in it, and based on the question, not based on where it's coming from, because we don't want to know where it's coming from. Based on the question, if it's a question or concern regarding, say, for example, upcoding or billing, well, that should trigger whoever's in the email chain. Hey, that's my department. I should be responding and investigating that. And if there's a question that's maybe just truly HR related, and it's or harassment related, oh, well, that should trigger our HR director, right? So if it's HIPAA related, we think there's an issue there, that should be the HIPAA officer. If, you know, whoever's in there, I think it should really be geared towards more of the type of question versus where it's coming from. But good question.
Okay. Let's see. Moving to background checks, is it possible to do background checks after employees have been hired? Is it required or is it optional? We have several questions around that same kind of topic.
You can. So I know we're not screen sharing right now, but even after they're an employee, so let's say, and maybe I'm thinking this is some existing clients saying, hey, we would actually like to perform some of these checks on some of our existing clients in the system. You can still go to that applicants tab and just hit create new applicant. We still want to do that because we still need to send the request to them. Now you could just plug in their company email and they'll just send them the instruction that way. But yes, you can perform background checks on existing employees.
And that kind of goes to the next question. It says, I see there is no option of a phone number, only communication we have with the candidate is through email. What if they do not respond via email?
So the reason that we need and you'll want to have this upfront conversation with the applicant if it's moved to that point where you're saying, hey, we need to perform some checks on you. Great. Here's the information I'm going to, you'll want to provide that instruction to say you're going to be receiving an email. I need to gather this information from you. You literally could be filling it out right there with them if they're in person or on the phone. It won't work. The system won't work if we have just a phone number because of all of the basically the checks and authorizations and the thing it's kind of like signing your life away sometimes when you receive those things saying, yes, I'm allowing you to pull my credit. Yes, I'm allowing you to access my criminal, all of these things. So we can't really do it through the phone. You will want to make sure that they can provide some kind of email address. If they don't, honestly, I would just practically say, at this stage of life, I don't know who doesn't have email addresses anymore, but if they don't, maybe set one up for them. Just go onto Gmail, Yahoo, Hotmail, Outlook, pick your one. But we will need, for the service to work, we do need the email address because that's the third-party vendor sends a lot of authorizations that way.
Final question on the background checks. Could HCP help draft or create an adverse action letter if needed? Would that be included with the service or an additional cost?
That's a good question. I mean, we'd probably, again, want to address that on a case-by-case basis. If you've purchased the service and you're obviously utilizing the background check tool, we will be more than happy to, your compliance specialist will work with you directly to the extent of how much we're doing there with writing the adverse action letter. Yeah, we're definitely gonna, if it's like, I think in essence what you're saying here is, you could be asking the same thing. Would you help us write the offer letter, right? So, but yeah, we would definitely want to be involved with you. to the degree, as long as it's not being abused, like, hey, I've just submitted 50 new employee applicants and I want you to write all this for me, HCP. Well, we won't take it to that degree, but will we help you draft what you should have in there? Yes, you get to ask that question. We'll help you to make sure you have the right language.
All right, and then I think this can probably be the last question we answer live. It's regarding the credentialing. It says,
Good.
you mentioned that you are not credentialing anyone, but we do have the medical assistant credentialing. Can you describe how that is different than what the credentialing manager is?
That's a good question. So yeah, I probably spoke out of turn to a degree. We do have some services. We have some professional certifications for HIPAA compliance officers. You can become a HIPAA compliance officer, or a certified HIPAA compliance officer, excuse me. We do have those courses that are tested that give you those credentials. We also have that medical assistant credentialing course. Now that specific credentialing course grew out of a requirement by CMS to say that in order for you to meet the requirements Chad, you might have to help me a little bit on this, to submit I forget the acronym, to submit yeah. So when you're making those submissions on behalf of the provider, nowadays when you're receiving your certification, your medical assistant certification through, online or through a school, they're covering this. But many of the grandfathered ones that knew the systems and were submitting online didn't have it. And so we developed that credentialing program. You could store this in here, but this credentialing system, think of it more of like this is your tracking and your tracking system for credentials. That's my long-winded answer to that. But yes, we do have medical assistant credentialing, and that is actually being managed. You don't need to put it in here. You could, but you'd be getting double reminders because that's being managed through the course itself. The course itself is going to send that reminder to the individual that's taking that course or keeping it up to date on an annual or by every other year basis.
All right.
Good question though.
Okay, well with that, we'll go ahead and close the webinar. We really do thank you all for joining us today. If you submitted a question that we did not get to, we will follow up directly with you after the webinar. As a reminder, please take a moment to complete the survey at the end of the call. Your feedback really does help us to improve. And then as always, feel free to reach out directly to your HCP representative or our support line anytime that you need assistance. And thanks again for joining us.